Okay, Brill. Hi everyone. Thank you for joining us. This is the Screening and the Importance of Prevention webinar for the Bolder Healthier Community Champions. My name's Helen Bissett and I work in the health protection team in Birmingham Public Health. And I'm also joined by my colleague Ayan on the call, who's worked on pulling these slides together. So in this presentation, we'll be covering screening and the importance of prevention, looking at when people should be screened, benefits of screening, and the effect it can have on people's lives. So next slide, please. Thank you. So what is screening? Screening is the process of identifying apparently healthy people who may have an increased chance of a disease or a condition. It is not a single test to identify if a person has a disease. Screening aims to identify disease at an early stage and usually does not completely prevent disease from happening. So today we're asking you, as a Bolder Healthier champion, to encourage your community to attend their routine screening appointments. Next slide, please. So let's go into some more details about screening. We can think of screening like a sieve. A large group of people take up the screening test, and most people will pass through it like you'd pass through a sieve. Some people will be left in the sieve, and in the diagram, those are sort of the orange people, and they will have a higher chance of having the disease, and further tests will be offered to those people. So, for example, many people will be offered and will attend breast cancer screening. The screening aims to identify abnormal areas in breast tissue that may be cancerous. For people where that has been identified, further assessment is then carried out to understand if the abnormal area is cancer, and if it is cancer, treatment is offered. So the further assessment will be carried out on the people who are orange in that diagram. The aim of the programme is to catch this early enough to improve the chance of recovery. Next slide, please. It's important to have a realistic expectation of what screening programmes do and don't do. Screening saves lives, reduces the chances of developing a serious condition or its complications, and allows for problems to be picked up sooner. It does not guarantee protection against disease, so it's vital that people are still aware of the signs and symptoms of diseases, even if you are attending screening. The vast majority of those who attend screening programmes receive an accurate response. However, all screening programmes will produce false positive results. These are positive results for someone who does not have the disease, and false negative results, which are negative results for someone who does have the disease. These are both kept at a minimum through the design of the programme and its quality assurance. Next slide, please. So screening is different from other aspects of healthcare, as it's apparently healthy people, as opposed to people who are unwell, who are invited for screening. And informed consent is central to screening. This is making sure individuals have all the relevant information in an accessible format to be able to make an informed choice. And informed consent has two components, both the information that they need and also informed consent with regards to making the right choice, essentially. So the information given to these people should outline the benefits, also the risks. So an example of risks and benefits for cancer screening is displayed on the right-hand side of this slide. So risks can include missed cancers and false alarms, side effects and overdiagnosis, which is when cancers are picked up that wouldn't have gone on to cause any harm. But benefits can include saving lives from cancer through detection at an early age, and sometimes even preventing a cancer developing. Next slide, please. So, as discussed previously, screening is a way to find out if an individual is at higher risk of a health problem, so that early treatment can be offered, or information can be given to help them make informed decisions. The NHS offers a range of screening to different sections of the population who are most likely to benefit from it. And these are the national screening programmes. And every person is a part of a screening programme at some stage of their life. For example, abdominal aortic aneurysm screening is offered to older men who are most likely to benefit from the programme, whereas those with diabetes aged 12 and over are most likely to benefit from the diabetic eye screening programme. Next slide, please. So this slide gives some benefits of screening programmes. The national programmes are estimated to save over 10,000 lives each year, with breast and cervical cancer screening saving over 6,000 lives per year, and bowel cancer screening saving 2,400 lives per year. Nationally, these programmes invite over 15 million people each year, and 10 million people take up the invitation. We want to make sure those people who haven't taken up the invitation of screening programmes have all the information they need to make an informed decision. Next slide, please. So why should you attend screening? So we can take breast cancer screening as an example. Breast cancer screening offers early detection of the disease, with the early detection offering the best chance for successful, simple, and less distressing treatment. It's quick, with the actual screen itself taking approximately 6 minutes. It's proven. Mammography, the test used during breast cancer screening, is very good at correctly identifying changes, and it's effective, saving around 1,400 lives in England annually. So in summary, you should attend screening if you're invited, because screening can detect a problem early before you have any symptoms. Finding out about a problem early can mean treatment is more effective. And finding out you have a health problem or an increased chance of a health problem can make people better informed, can help people make better informed decisions about their health. Next slide, please. So on the right-hand side of this screen, you can see the timeline of the national screening programmes through a person's life. The national screening programmes include bowel cancer screening, breast cancer screening, cervical cancer screening, diabetic eye screening, and abdominal aortic aneurysm screening. Next slide, please. So let's go into a bit more detail about each of these programmes. So bowel cancer is a disease that causes over 16,000 deaths in the UK each year. Bowel cancer screening can detect bowel cancer at an early stage when treatment is most likely to be effective. The screening test looks for blood in the stool sample, and those eligible receive a home test kit by post and return the sample for lab analysis. So the video on this slide goes into more detail about how this works. So we're going to let you view this video in your own time, and there are a few videos coming up which will let you look through in your own time as well. People aged 60 to 74 are automatically invited to take part in bowel cancer screening every 2 years. So next slide, please. Breast cancer is the most common type of cancer. There are about 12,000 breast cancer deaths in the UK every year. 1 in 8 women are diagnosed with breast cancer in their lifetime, so early detection is extremely important. Breast screening uses an X-ray test called a mammogram to check for signs of cancer, and the video on this slide will give a bit more detail about how this works. So this screening is offered every 3 years to women and others eligible aged 50 up until their 71st birthday. Next slide, please. So as we discussed before, screening does not guarantee protection against a disease. So it is vital that people are still aware of the signs and the symptoms of the diseases that are being screened for, even if you still are attending your screening appointments. The picture on this slide shows some changes to be aware of in between your breast cancer screening appointments. If these changes don't go away, you should make an appointment with your doctor. Next slide, please. So this is another video to look at in your own time, but it gives some common questions and answers about breast cancer screening. Next slide, please. So cervical screening looks for abnormal cells in the cervix, which, left untreated, can turn into cancer. This screening is important as there are about 850 cervical cancer deaths in the UK every year. The screening test involves a small sample of cells being taken from the cervix and then sent for lab analysis. If the results come back positive, you are referred automatically for further testing. All women and people with a cervix aged between 24.5 and 64 are eligible for cervical cancer screening. And there's a link at the bottom of the slide to the NHS website with some further details about the programme. Next slide, please. Diabetic eye screening is offered every year to those with diabetes who are aged 12 years old or over. The screening is checking for signs of diabetic retinopathy, and this is a condition caused by diabetes, which damages the small blood vessels in the retina at the back of the eye. Eye drops are used to temporarily make the pupils larger, and then images of the retina are taken. This screening is important as if diabetic retinopathy is undiagnosed and untreated, it can cause blindness. Next slide, please. And finally, abdominal aortic aneurysm screening checks for weakness and swelling of the aorta. The aorta is the main blood vessel that runs from the heart down through the chest and the abdomen. This screening is offered for men aged 65 and older, as they are the group in the population that are most at risk. They will receive a one-time invitation to be screened when they are 64 or 65. The screening test is a painless ultrasound scan of the abdomen, which measures the width of the aorta. This screening is important as typically an abdominal aortic aneurysm will have few or no symptoms, and if not detected, it can grow and burst, which is usually fatal. And as previously, at the bottom of the slide, there's a link to the NHS website, which has some more details about this programme. Next slide, please. So what can we do to help? And this is where the Bolder Healthier Champions come in. Next slide. So your role as a Bolder Healthier Champion is to talk about the importance of taking up screening, to inform people when they should go for screening, and to encourage them to go when it's offered. You can share these important health messages by distributing the information you've learned today into your communities. You can connect people to the resources that can help them or someone they know. And that can be from a website or through a helpline or an organisation. And finally, you can feed back to us. You can tell us if our information is useful, what other information you think would help, what else we can do to help get the message across, and if there's a particular topic you'd like us to focus on. Next slide, please. It's important to remember that talking should always be done with the intention of helping connect people to the right support and not taking on the responsibility of offering professional guidance. Always use approved information and try to remain neutral. Don't get personally involved with the people that you're trying to help. Next slide, please. So what would you talk about? You'll spot people who may need your support, share the messages and encourage people within your communities to go for screening appointments when appropriate, and promote these webinars in your network. So on this slide, there are a few examples or suggestions for how to talk about screening within your community. You could ask if they have all the information they need to make an informed decision on screening, if they know where to access screening, if they know what screening they're eligible for, with some more examples of questions on the rest of the slide. Next slide, please. So this is an example of how you can offer brief support and help without getting personally involved. It's called the Ask, Advise and Act model. You can offer brief and immediate support to find out what help is needed, and then direct the person to the resources that we've given you throughout this presentation. Next slide, please. So sometimes you can help someone best by offering practical support, especially if they're struggling to find the time to research the information for themselves. In this case study, a Bolder Healthier Champion is on a walk with their friend who has just received an invite to attend cervical screening, but the friend isn't sure that they want to go. Next slide, please. So the Bolder Healthier Champion points their friend to information about cervical screening, and this may help them make a decision on whether to attend the screening appointment or not. Next slide, please. This slide brings together a directory of resources about screening, and it may be helpful to support you in your conversations with your community and to help connect people to the right and approved information they need to make an informed decision. Next slide, please. We also want to know where more help is needed so we can continue to improve the support for citizens. As the eyes and ears of the community, you can tell us where more help is needed and how best to provide it. You can email us through the contact details on the screen or connect with us through social media at any time. Next slide, please. Finally, thank you for volunteering to be a Bolder Healthier Champion. We hope you're enjoying these sessions and enjoying promoting positive health and supporting your community to improve their health and well-being. Your role as a Bolder Healthy champion is to share the information into your communities and to encourage and support health and well-being. Our champions are advocates for important health messages in Birmingham by distributing this information into a wide range of communities and networks. We support you through monthly themed webinars and tailored resource packs. If you know someone who might be interested in taking part, then please encourage them to find out more by either searching Bolder Healthier Champions Birmingham City Council or by sharing the link with them when you receive this slide deck. Next slide, please. And finally, thank you for joining us today. We couldn't do this without you. We really hope this information was useful to you. So yeah, thank you very much for your time.